Hello, and welcome to today's webinar on the case for decriminalising suicide, conducted with the International Association for Suicide Prevention and the Global Mental Health Action Network's Suicide Decriminalisation Working Group. The webinar is part of the Mental Health for All series that United Global Mental Health has been running since April last year. My name is Sarah Johnson, and I'm a journalist at The Guardian. I report on human rights and global development. Previous to this role, I spent 8 years also at The Guardian focusing on healthcare and wider social affairs. I've always had an interest in mental health, and I'm thrilled to be here today to discuss a hugely important and sensitive topic. Here with us, we've got a stellar lineup of panelists who I'm really excited to hear from. Natalie Drew is the Technical Officer for the Policy, Law and Human Rights team of the World Health Organization's Department of Mental Health and Substance Use. As part of her work, she supports countries to reform policies, plans, laws and services in line with international human rights standards. Dr. Soumitra Pathare is a consultant psychiatrist and the director of the Center for Mental Health Law and Policy at the Indian Law Society. He helped draft India's Mental Health Care Act in 2017 and has served as a World Health Organization consultant in many low and middle income countries. Senator Shahadat Awan is an advocate of the Supreme Court of Pakistan and a sitting member of the Pakistan Bar Council. He became a senator in March 2021 and is the Senate member who tabled the bill to decriminalise suicide in Pakistan in September. We'll spend the next 45 minutes or so discussing key points with our panel, and then I'll open the discussion up to the audience. I'd love to hear any questions that you have, so please put them in the chat box and we'll address them in the last 10 minutes of today's session. Before we get into the discussion, Wendy Orchard, the Executive Director of International Association for Suicide Prevention, is going to say a few words. Over to you, Wendy.
Thank you, Sarah. And thank you for the kind introduction. Yes, I'm Wendy and part of the International Association for Suicide Prevention, which I'm going to quickly shorten to IASP because it's easier and quicker to get through for the next few minutes. Just to tell you a little bit about IASP, we're dedicated to preventing suicide globally. I will share our link to our social media and to our website. You can find out more about us there. And we are really delighted to co-chair the Global Mental Health Action Network Suicide Decriminalization Working Group with United for Global Mental Health. Many of you will know, and I hope are part of the Global Mental Health Action Network. This is an open community of mental health professionals who share a mission to protect the right to good mental health and work together to advocate to improve political and financial support for mental health across the world. With over 1,500 engaged members from over 100 countries, the membership is really broad. It consists of academia, governments, UN agencies, private sector, civil society, and those with lived experience and who work within the mental health system. It is the largest global mental health network of its kind in the world. And if you're not a member of this community yet, I would certainly encourage you to join. The network has a number of working groups, and the Suicide Decriminalization Working Group has been set up to champion advocacy for the decriminalization of suicide and suicidal behavior in countries where this is still criminalized. There's over 20 countries where it's still criminalized, and then there's also about 20 more countries where subject to Islamic law, it is also criminalized. So the key focus area of this group is to develop campaigns and advocacy ideas for such decriminalization campaigns, which can help us drum up action and approach those in policy and government levels to try and decriminalize suicide, because you'll hear in the webinar many good reasons for it not to be criminalized. including and very importantly, to encourage people to seek help. The key focus recently for the group has been the launch of the decriminalisation report that United for Global Mental Health put together and launched this September in the run-up to World Suicide Prevention Day. If you haven't read it, Ali or one of the team behind the scenes will surely share the link with you on the chat function. Please do. You can download it as well, take it away, read it. It includes both global perspectives and country-specific details, which will help us to advocate for decriminalisation. The Global Mental Health Action Network is open to everyone, and the Suicide Decriminalisation Working Group is a wonderful and engaging group exploring ideas and sharing perspectives from all over the world. I've had the privilege to join them in those discussions, and I would really recommend, if you're not a member, to join us. Please do. So thank you and enjoy the webinar.
Thank you, Wendy. So we'll get on to the discussion. I'd like to start off by asking Natalie why decriminalizing suicide is a target of the World Health Organization's comprehensive mental health action plan. Thanks, Natalie.
Thank you very much, Sarah. Thank you very much to United for Global Mental Health, first of all, for inviting me to this important webinar. And thank you, Sarah, for the question. Yes, in fact, the WHO Mental Health Action Plan has just been updated and has included an item on decriminalization of suicide as one of the new options for implementation being proposed to governments. And this really is reflective of the fact that decriminalization is being seen now as one of the most critical sort of tools, measures in the whole arsenal of suicide prevention efforts and strategies in countries. We know that globally suicide is a major cause of mortality, and that it's the second most common cause of death among young people. And not only is this loss of life tragic in itself, obviously, but it also has profound and devastating effects on families, on communities, and on entire countries. And the problem isn't going to go away, because we're actually seeing rates of suicide actually increase in many countries. And the fact that suicide is still, as we've just heard, a criminal offense in so many countries only really serves to compound this situation. Basically, criminalizing suicide means we're punishing people for their distress, which not only denotes a serious lack of compassion for what people might be going through, but it's also unjust and dehumanizing. And we know that the impact of criminalization can be extremely negative. So, for example, people, as again has been mentioned, people experiencing suicidal thoughts are unlikely to seek help and support. They're more likely to hide their distress. And very often people are confused about how or even if they can seek care and help for what they're going through. So, and obviously this can also potentially lead to an increased risk of attempted suicides. And then, of course, the public shaming, the stigma around suicide also stops families who may have been affected by suicide from seeking support for their own bereavement as well. And then the stigma on the people concerned and their families more generally can often lead to exclusion, to marginalization, pushing people further into their despair, into their distress, and also obviously pushing people deeper into poverty as well. So decriminalization is really key to making sure that people are not marginalized, that they're not stigmatized, and that they're really able to seek the support that they need. And decriminalization also really helps society to open up the whole conversation around mental health, around suicide more widely, and it enables people to basically talk about more freely about their experiences, what they're going through, their distress, and so on. So instead of shaming people, causing fear in the minds of people who attempt suicide by threatening to imprison them or to punish them in some way, we really need to focus our efforts instead on promoting access to quality services that are human rights oriented, that respect people's rights, that respond to their needs, but in a really holistic way that really considers all aspects of their lives. Basically, we need services and supports that support people regain meaning, that help people to regain purpose in their lives, and also to have hope for the future. So all of these factors, all of these reasons that I've just outlined underline why decriminalization has now found its place within the updated WHO Mental Health Action Plan. I'll stop there, thanks.
Great, thank you, Natalie. On to Shahadat. Would you be able to tell us what motivated you to table the bill in Pakistan, and what hurdles stand in the way of decriminalizing suicide in your country? You're on mute, and can you turn the camera on? Senator, are you there?
Yes, yeah. Can you hear me?
We can hear you. Can you turn your camera on? Did you hear my question?
Yes, yeah, I can hear you. I can hear you. Sarah, the question is that since last many years we were careful, we were knowing that so far the suicide is concerned, definitely it is an intent in the person who commits suicide, meaning thereby it is a disease. It is not a criminal offense. Camera काम नहीं कर रहा. It is not an offense, and that's why that in the year 19, one of our Dr. Amin Khaja, Karim Khaja, he tried his level best to put this bill in the parliament, but unfortunately he retired, and the bill was that lapsed in the National Assembly. And subsequently, Sarah, I moved this bill, but so far our country is concerned, you know, this is Islamic country, and there is a religious matter that so far the death and life that is concerned, that is the divine decree of the God. And therefore, many our religious people, they do oppose this suicide matter. But anyhow, the majority of the country are concerned, they know that this is a disease and we should take care of that disease. That's why that we moved that bill, and it was laid in the Senate, and subsequently it was referred to our standing committee, and the majority has unanimously passed that bill, that this section, this law should be remitted from our law books. And I hopeful again it will go to the Senate, and from the Senate it will be remitted to the National Assembly, and it will be passed. The question is, you know, that so far the suicide is concerned, there are many factors contributing for the suicide, and we all are unanimous on this issue that it is a disease, and it should be considered as, it should be cured as a disease, not an offense. There are many factors for this suicide. Suppose sometime so far in Pakistan is concerned, the boys ranging from the age of 10 to 20 years, they are victim of the suicide. And apart from that, those who are seriously ill, personal problem, marriage, family, financial matter, they attempt to commit suicide. And they need treatment. Instead of that, they should be put behind the bar. And normally, if someone attempts and he survives, and only because the fear of the offense, they are deprived from the treatment. They never go to the medical legal officer. They never goes to the hospitals. And definitely, if there are chances for their survival, because of this deterrence and because of this apprehension, they dies unattended from the medical treatment. And that's why that we are conscious of this fact that at least this offense should be remitted from the law books, so they can avail the medical treatment. And suppose this law remains, meaning thereby that we are depriving our persons from the lawful right of their treatment. That's why we are taking efforts. You are also making efforts in that way. I'm hopeful that within 1 or 2 months, this old law that will be deleted from the law books, and in our country, so far the suicide is concerned, that will be no more crime in Pakistan.
Thank you. Hugely interesting to hear from you, and it's almost history in action. Dr. Soumitra, can I ask you what was the motivation behind decriminalizing suicide in India, and what were some of the key aspects to making it happen?
Hi, Sarah. Thanks for the question. And first of all, I'd like to thank UGMH for organizing this webinar, as well as for inviting me. And I'm not going to repeat many of the important points that have been made by both Natalie and the senator, but just try and give you some context from India. The first thing to say is that the Mental Health Care Act, which was passed in 2017, did not really, in a true sense, decriminalize suicide. Suicide as attempted suicide, actually, because suicide is not a criminal act as much as attempted suicide is. In fact, I've always joked that it's one of the only crimes where when you're unsuccessful, you will get prosecuted, whereas successful crime will not result in any prosecution, which makes it a very bizarre crime. But attempted suicide is a crime under the Indian Penal Code. And the Mental Health Care Act was being drafted from around 2010 that I was involved in it. And we thought that there was an opportunity to try and also look for decriminalization of suicide. Now, it was very clear that the government of the day and the subsequent governments have kind of wanted to change the Indian Penal Code, and there is some process underway. And so there was no way of us trying to just remove one section from the Indian Penal Code. But we took the opportunity with the Mental Health Care Act to effectively make the provision in the Indian Penal Code, nullify the bite of that particular provision. So what the Mental Health Care Act of India really says that despite what other laws might say, anyone who attempts suicide is to be presumed to be suffering from severe stress and therefore offered care, treatment, and rehabilitation. So it's a presumption, and the police could always, the legal authorities could always rebut that presumption in court and try to get out of it and still prosecute people, but it's unlikely to be happening. There is a general groundswell of opinion in India that suicide needs to be decriminalized, and there's been a lot of writing around it publicly as well as by academics. Many attempts in the past to try and decriminalize suicide. So it's not a new thing that we were embarking on. The second thing is that one can have a philosophical discussion as well as practical discussions on decriminalization. And when we were trying to do this kind of reading down of the criminalization section of the IPC, the Indian Penal Code, we really focused on the practical aspects, because I think the philosophical aspects one can get into in much depth if you want. But the practical aspects were as follows. First is from 1947, when India attained independence, there had been only about some 300 or 400 prosecutions that the police had ever launched for an attempted suicide. So, it made no sense to have this kind of a thing, a law which was not really being used. The second and very important issue that we did raise was that, and especially from survivor testimonies, was that many people reported harassment at the hands of the police, for example, for this attempted suicide efforts. And so it was another way of trying to reduce people who are already in distress and attempting suicide from further harassment from law enforcement agencies. And that kind of made sense to a lot of people. The third and most important thing was to allay the fears of judiciary, for allay the fears of parliamentarians, for example, that, well, will it result in increased suicide? You know, the idea of the law or criminalizing suicide as a deterrence to suicide attempts. And we were able to show them a lot of evidence from different countries to say that, look, it doesn't act as a deterrent, and reducing suicide, reducing or removing criminalization might actually reduce the number of suicides. And that's the evidence from many countries which decriminalize suicide. So, you know, instead of seeing an increase in attempted suicides, we are likely to see a decrease in attempts of suicide. So those were, I mean, I'm just summarizing a few things into a sound bite of 2 or 3 minutes, but those were a few of the important reasons why people, you know, I think we were able to build a coalition of stakeholders from within the community to actually advocate for it and then get it through Parliament. Yeah, thank you.
Thank you, Soumitra. Interesting to hear what happened in India. If we can go back to Natalie now, how can the World Health Organization and global organizations such as the Global Mental Health Action Network support work to overcome the hurdles and challenges identified by policymakers?
Thanks very much, Sarah. So I'll start off by talking about the role of WHO, the role that we can play as the World Health Organization. Well, as an intergovernmental organization, we have this, you know, incredible power to convene. So we can engage directly with governments, ministries of health, obviously, but also ministries of justice, national legislative bodies, religious bodies, and others around this whole issue. And it's through this dialogue and discussion that we can really address some of the main reasons which people are using to justify criminalization, whether it's around cultural justification, religious justification, or punishment as prevention sort of arguments as well. And this dialogue with the different stakeholders who are resistant is really key in order to really be able to understand their perspective and also to propose strategies to overcome this resistance that we see in countries. Then also as an organization, we can provide technical assistance to countries in different ways. So we can support efforts to undertake comprehensive assessments to look at what are the actual barriers within countries to decriminalization. We can also help to analyze, you know, the legal and the policy landscape in the country and provide technical support towards, you know, supporting decriminalization reform efforts. And then we can also support countries to put in place comprehensive policies and programs to address suicide. So policies and programs which address, for example, socioeconomic factors that are impacting on mental health and suicide. Also policies and programs which focus on limiting access, the means to suicide, so access to firearms, to toxic medications, pesticides, and so on. And then also policies, we can support countries to put policies and programs in place which promote holistic services to be made available to people themselves and also families as well. But then there are other roles in which civil society and networks, and like the Global Mental Health Action Network as a prime example, where these groups have a strategic advantage. Supporting the development of strong coalitions and lobby groups in countries is one example. These groups really play a critical role in conducting advocacy campaigns, and they can also play a really fundamental role in putting pressure on governments to take action on this whole issue. These organizations and networks also can really work to rally people with lived experience in these sort of mobilization efforts. And we all know that hearing the voices of the people directly concerned, so people who've attempted suicide, but also family members who have been affected by suicide as well, that this is one of the most powerful ways to really changing attitudes sustainably on these different and difficult issues. And then also there's a role for organizations and networks to engage with the media. So that means engaging with traditional media and also social media, engaging these different platforms to get them to be part of the public information, the public awareness campaigns, and so on, around the importance and the need to decriminalize suicide. So these are just some of the actions that can be taken. And all of these different roles, the roles that I've mentioned around what WHO can do, what civil society partners and networks can do, all of them are really complementary and can make a real difference, I think, to bringing about positive change and decriminalization in countries.
Thank you, Natalie. We've actually had another panelist join us. I'd like to introduce Joseph Osafo, who is Associate Professor of Clinical Psychology and Head of the Department of Psychology at the University of Ghana. He's also hugely involved in the decriminalizing suicide movement. Joseph, could I ask you, what is the historical context behind suicide being illegal?
Thank you very much for welcoming me. I had an initial challenge in getting the link, but finally I'm here. I think a few things are important for me to clarify. First is the initial difficulty that we discovered when we started working on suicide, and discovered that a lot of those who were surviving after attempts were vigorously being incarcerated. And so what we did was to first put together evidence from various stakeholders. And here I'm talking about judges, I'm talking about lawyers, I'm talking about police personnel, I'm talking about religious leaders. What we did was to take the research to them and get the evidence and hear them speak about why this behavior should be criminalized or otherwise. And so it started from there, and we give ourselves some months to gather the data, put it together, analyze, and then invited them to be part of training programs. In these training programs, we shared with them the various, the findings we have put together, and left this for them to make their own judgments. And then from there, we were able to organize mental health practitioners. So at the time, I was a faculty member at the Department of Psychology, and I was leading the first ever university-sponsored project on suicidality in Ghana, titled Suicide and the Risk, Suicide Law and the Risk. And then when the data came out, we equally organized stakeholders conference. And this stakeholders conference was an amalgamation of mental health experts, psychiatrists, psychologists, social workers, nurses, what have you. So they all came. And then we put up the findings, indicated a number of people who are at risk, young people, and then showed them what the police, the judges, and others are saying about decriminalizing. So from there, we put together a program, and then did seek to get audience with Parliament. So it started in 2012, and then we presented a petition. Then, I mean, as usual, in most countries, parliamentarians will be very much not enthused. You need to lobby them a bit stronger in this part of the world, and I guess elsewhere. We don't have that amount of money. So then we went to the second phase in 2017, when again, after putting a data together, we revisited Parliament. And this time around, what I did was not to just the usual marching through town, drawing the public's attention to what is happening, and then in front of Parliament, as usually is done, a speech is made and then the petition is presented. We thought that the motion, it's just going through the same motion and nothing will come out of that. But what I did was to seek audience with the various parliamentary select committees. So for example, I managed to get through to the Parliamentary Select Committee on Women and Children. And then I met with them. I give them the data, I give them the reasoning. We spent about an hour. Then from there, I met the Parliamentary Select Committee on Health. We engage on issues. Then from there, I also engage another group. This group is not a Parliamentary Select Committee, but it is the Ghana law. It's a law group that will look into petitions in changing or expunging any code in a criminal code. They will come to you, I've forgotten their name, reason with you, and then help you put together a very strong petition, which will be sent to the, this time around, not Parliament, but the executive. And you could equally send this petition to the Attorney General for consideration. So we did that as well. So the third level was to see what we can do with judges. And so again, we sought audience with judges. This took a while, and we managed to get to the judges, about 246 judges across the country, and give them the data, did the presentations of mental health, usability, the driving factors, why it should not be criminalized, and all of those. Then from there, the police unit, and this was at the head office of the Ghana Police Service in Accra, which is the capital city of Ghana. That's where any event on suicide is sent to them, and then they will prepare a docket. They will ask you to prepare a docket on a person and maybe, just quickly push and send it to the nearby judge or judicial service for the person to be incarcerated or fined. After this training, I got one-on-one encounters with some judges who actually had difficulties with their own wards and needed mental health engagement, and then took the opportunity to really explain to them what we were seeking to do. Now, from there, the mental health group made up of psychologists and psychiatrists now put the petition properly together and then began circulating this to various parliamentarians. Because
sorry, Joseph, can you get your last point? I've got lots of other questions coming through.
Okay, a minute and I'm done. And then we did send the petition to various parliamentarians because the Parliament of Ghana had just passed this opportunity for a private member's bill to be, that can be raised. And so we were looking for that a private member's bill can be sent to Parliament. And that is where we are now. So currently, the circulation within the judicial space, the parliamentary space, and the public space generally is been very good, and we still are pushing. We haven't succeeded in expanding the code, but what we have greatly succeeded in doing is to water down the aggression and then the enthusiasm with which people were incarcerating those who were attempting, at least for now, for the past 3 years or 4, nobody has ever sent anyone to any court to be incarcerated. Most likely, they will call my unit, Center for Suicide and Violence Research, for support. Thank you very much.
Thank you, Joseph, and so interesting to hear about what's going on in Ghana. If we could go back to Shahadat, do you see a role for the global community in the movement to decriminalize suicide in Pakistan? Do you think global pressure can be effective? Senator, are you there? You're on mute.
Sarah, I say that we are on the, at this stage, we are on the initial stages, and the bill has to go before the Senate, the National Assembly, and at the last when it will be deleted from the law. Then thereafter, the question is that how the international community help Pakistan and guide us to provide the legal, provide the medical facilities to such patients. Here the question is, at the most, at this stage, you can write to the parliamentarians, you can appreciate them that we are doing a good job in our country. And comparatively, you can apprise them that in the country where this offense has been decriminalized, what was the after effect of that position? The question is, so far they, as the doctor has properly that he has disclosed that so far the person though who survive in the attempt, that is the major problem for them. Definitely those who succeed in the suicide, I think so that nothing is required for them. The person, those survive, they require treatment and they are worrying, they can't go to the hospital, they can't go to the police station, and lastly, they can't survive from their life. And I think so that it is a good step which our nation is taking at this stage. And that is a good sign that, as earlier I have told you, that in the standing committee, the bill was unanimously, they were of the view that so far this offense is concerned, it should be deleted from the law books. So likewise, the other countries, the victims, those who are patients, those who are misbehaving and causing danger to themselves, they should be counseled, they should be provided treatment, and the state should help them that we can save their lives. Sarah?
Thank you so much. Great to hear from you again. Can I turn again to Soumitra in India? I appreciate it's a complicated situation there, but what impact have you seen since the law change? Can you talk about that?
Well, anyone who's had any dealings with India will know that changes in the law happen in India all the time. For them to translate into practice on the ground takes an equal amount of advocacy and effort from everybody concerned. That is one issue. The second thing is that, we decriminalized or we had the Mental Health Act come into force in 2018, and we've had the pandemic subsequent to that. So at the moment, I wouldn't have, and there is no data which has been released by the National Crime Records Bureau to show whether suicides have gone up or gone down after the Mental Health Care Act. But the biggest problem with getting quantitative data in India is the fact that we do not collect. Nobody systematically collects either at the national level or at the regional level data on attempted suicides. And so there is no way of knowing whether suicide attempts have increased or decreased subsequent to this law being passed in the country. So, it's very difficult to give you quantitative data of impact of it. But what I can tell you from a qualitative perspective is that it's had a major impact in many ways. One is it's put suicide prevention in the public domain into conversations. It became a good starting point for a lot of good quality journalistic writing on suicide prevention and the need for suicide prevention and the need for suicide prevention programs. So it's opened up a public discourse and conversations around suicide and suicide prevention. So that's been very positive. The second thing it has done is if you talk to many survivors of suicide attempts, they will tell you that one of the biggest challenges used to be having to deal with law enforcement agencies after an attempt, and especially for the families too. And that seems to have become less of a problem for them. Again, this is all qualitative data. There is no way of having numbers. In fact, one of the things that we've been trying to encourage not only the government of India, but also our regional and state governments to set in place some way of collecting suicide data on suicide attempts. In fact, we've also designed some methods by which this data could be collected quite effectively and in a sustainable, scalable manner at reasonably low cost. And could be adopted across the country. So I think the challenge for us really in suicide prevention in India is that decriminalization was just one small step in a long road to getting effective suicide prevention strategies in place in the country. Thank you.
Thank you so much. So we're going to move on to questions from the audience. We've got quite a few. So first of all, I'm going to address this one to Joseph, if that's okay. In Ghana, suicide is still illegal. What is the fact that it's illegal, does that act as a deterrent, would you say?
I'm sorry, there's a lot of noise here. There's a rainfall and they're trying to cut a tree.
Would you like me to
just skip this one and I'll come back. They will finish soon so that you can hear me clearly.
Okay, perfect. So next question, question for Shahadat. What is your take on the argument that punishment for suicide, it's a similar question. Punishments for suicide would act as a deterrent. Can you take that one, Senator?
Yes, Sarah.
Did you get that question? Would you like me to repeat it? Oh, you're on mute. Are you there? Okay, we might be having a few technical issues. I'll move on to the next question. Right.
Yeah,
so
if you want me to
is
try
there...
and answer that question, I'm happy to.
Oh, okay. Thank you. Yes,
yeah.
Please go for it.
Yeah. Well, I mean, look, let's, this is not a matter of opinion. Does criminalization deter people from attempting suicide? And this is not a matter of opinion. Let's look at what the data says. If, for every suicide that happens in the world, there are close to 4 to 20 times the number of attempted suicides. So if we have about 800,000 suicides in the world per year, that really means we have roughly around anywhere between 4 to 20 million suicide attempts in the world. And so many countries have these deterrent laws. If the legal deterrence worked, then we should have seen those suicides and attempted suicides go down. which we haven't. What we've seen over the years is suicides and attempted suicides go up. So clearly the law as a deterrence is not working anyway. And then let's look at the other side of the coin, which is if you did not have this law and if you removed the decriminalization, then by the logic that is always being argued, then suicides as well as attempted suicide should go up. But again, if you look at the evidence from countries which have decriminalized suicides, in the years and the decades subsequent to the decriminalization, suicides and attempted suicides have not only not gone up, they've actually gone down. And again, I think one of the important things that people need to understand and remember is that suicides are a complex, multifactorial event and a condition. There are plenty of determinants. Some of the determinants are at the level of the individual, some of which is maybe like a mental health problem. Some of the issues are at the level of, say, family, example, domestic violence, alcohol consumption, those kind of issues. And then there are some issues which are more at the broader community and society level, such as issues like unemployment or access to lethal means of suicide. Now, these are all things that matter. And if we are going to try and prevent suicides or reduce attempted suicides, then we need to be working at all different levels. And it would be quite naive of us to say, oh, if we did one thing, then it should bring down suicides by themselves. If only life was so easy, then we would have already prevented all suicides across the world long time ago.
Thank you. Thank you for that. So let me just look at our next question. How can the general population get involved in decriminalization efforts? Natalie, do you want to have a go at that one?
Yes, thank you. Thanks very much for that question. I think, I sort of mentioned that there's a lot that can be done by civil society actors, by networks such as the Global Mental Health Action Network to really engage in the whole issue of decriminalization of suicide. As I said, I think other people have said, we really need to hear, I saw it in the chat, in fact, we really need to be engaging with people with lived experience, so people with lived experience of attempted suicide, self-harm, and so on, and also with families as well, because as I said before, hearing directly from those people is really going to have an impact. I know that strategies in certain countries have sort of mobilized champions. So it could be champions at the community level, for example, local sort of personalities or prominent people within the community, or it can be, musicians and politicians and so on, these champions who can really, really make a difference in sort of bringing the issue to the light and engaging the general community and society on these different issues. I think there is an important role with the media. I think that what we often see is sort of reporting around suicide that is not as it should be. There's a misunderstanding and misreporting around suicide. So I think that there's really an important role there for civil society and others to really engage with the media and make sure that there's responsible reporting around that. And just generally, we need to open up the conversation in society around mental health issues, around suicide, and so on. So I'd say that there's a lot for people to do at many different levels.
Great, thank you, Natalie. So still got a few more questions. We've got one about, is there a website that includes research from different nations around the world to show different perspectives on suicide and mental illness? I don't know about that, but there was a report out recently. Would any of the panelists like to talk about where people can find out more about decriminalizing suicide and the various different countries' attitudes to it?
Sarah, I would encourage people to go to the WHO website. WHO has put together, there was one report earlier on about 5-6 years ago, which was about reducing suicides, which put together all the data into one book. And then recently, they've also started a new initiative and campaign for suicide prevention, where you will be able to find all of that data and from across the world. And it is all free to download. I also know that the United for Global Mental Health have also put together a document on their website, which I think Ali had previously put a link in the chat. So again, that's something that you can refer to. The third place you will get information is on the International Association for Suicide Prevention's website. Again, there you will find some information. So there's a lot of information available out there, and it's not difficult to find. It's free to download. Thanks.
Thank you, Soumitra. One more question, which is, it's quite a broad one, but someone's asking, what is the cause behind suicide? What is the root cause? I mean, there are usually various factors, but perhaps someone with more knowledge than I can talk about that. Soumitra's put his hand up. I can't see anyone else, so go for it.
I think the causes of suicide are very complex. There's no single cause that happens. They vary from country to country, so that in different countries you might find different reasons for suicide. They also vary from time to time, so that there might be some distal factors, like, for example, the history of child abuse, for example, makes you more prone to attempting suicide when you are an adult. So these are very distal factors. And then there are immediate factors. Immediate factors can be, for example, under the intoxication of alcohol, or experiencing domestic violence or interpersonal violence. So these could be immediate factors, or the immediate experience of unemployment. So all of these are possible. And I think one of the things that the media needs to do is to really try and put across a more complex narrative around suicides, rather than simplistically make it like A led to B kind of a narrative that you frequently find in the media around suicides. And the most important thing is that suicide reasons for suicide vary hugely across countries. If you look at Western countries, especially Europe and North America, then mental illness is a very, very prominent cause of suicides. Anywhere up to 70 to 80% of people who might die by suicide will have a history of a mental health problem. Although recently NIH did put out a report from the US saying that was only about 50% in their studies. But if you come to the low and middle income countries, then mental illness is a far lesser reason for suicides, anywhere between 40 to 50%, whereas a lot of other psychosocial factors take precedence and are predominant in those cases. And the second thing and most important thing to remember is that 80% of suicides in the world happen in low and middle income countries. And so if we are going to look at suicide prevention, then addressing the problem or the situation, or doing something for it in low and middle income countries is important, which really means we should address the causes of those problems in those countries, rather than based on data which is available from Western countries. I'll stop here and not go on and on. Sorry.
Thanks, Soumitra. I appreciate it's a hugely complicated answer and so much to say. Natalie, did you want to say something very quickly?
Yes, just very quickly, just to sort of build on what Soumitra was saying, that we need to look at the underlying determinants of mental health, and we really need to be understanding what the different barriers are that people are experiencing in terms of fully being able to be included in society. So whether it's what different lack of opportunities they're experiencing in employment, in housing, poverty, discrimination, and so on. So it has to be a holistic approach. It's not just a legal approach. And in this way, in a way, decriminalization can actually become a catalyst to providing better support and better services for people and for their families. I just want to mention that I should have mentioned before, in terms of the question about what can we do at the community level to support people to address this issue. There are a number of WHO resources specifically looking at community engagement. So there's a toolkit for community engagement and also an e-learning course. And as Soumitra said, that is all available on WHO's website. You should be able to find it very easily, but if you don't, I can share it with our colleagues at United and they'll be able to share it with you. Thanks.
Thank you. Right, we're approaching the end. So just before we say goodbye to the panelists, I'd like to invite them all to end with a tweet length, so short answer to the following question. Why does suicide need to be decriminalized? Natalie, why don't you go first?
Thank you. So mine is very short. Suicide needs to be decriminalized in order to humanize people's distress and society's response to it. Thanks.
Soumitra, you go next.
Well, to paraphrase a very famous politician, it's 2021. Why not should it be decriminalized, especially when we know that it doesn't help anybody?
Great and very succinct. Joseph, are you there?
Yeah, I'm here.
Can we have an answer to why we should decriminalize suicide? A tweet length answer.
Thank you. Why won't we decriminalize? If the person is in distress, why do you want to add salt to injury? The person is already in distress. And if they are in distress, they need help. They don't need incarceration. Thank you.
What a great answer. Love it. Shahadat, are you there, Senator? Senator, I think you're on mute. Are you there? I think we've got technical problems. Wendy, did you have an answer?
Hello.
Hello.
Hello, Sarah. Can you hear me?
Yes, I can hear you.
Yes, Sarah, I told you, since it is so far the suicide is concerned, it is a public health issue. It is not an offense, and it should be finished, since it will be a service to the humanity, and that is the global responsibility of everyone. That the patient should be provided the treatment, and not they should be sent to the prisons.
Thank you so much. Those were great answers. So that brings us to the end of this hugely informative and enlightening webinar on the case for suicide decriminalization. Thank you so much to all the panelists and to all our audience members. The chat's been buzzing, loads of questions. Everyone's really passionate. It's great to see. Please do feel free to continue the discussion on social media using the hashtag MH4All, MH for mental health. Next month's webinar is at the same time on 30th of November and is about integrating mental health into universal health coverage. Thank you once again to all our panelists, and take care and have a great rest of the day.